Assalamualaikum warahmatullahi wabarakatuh. We are from College Student Bachelor of Nursing 2B, STIKes YPIB Majalengka. Introduce, my name is Silmiano Kolbi and my partner is
Aksanur Oktaviani. Here we will show the result of the communications statement, namely the presentation of a mini thesis from the total group of 24 groups.
Listen well and enjoy watching.
Assalamualaikum warahmatullahi wabarakatuh. Good day everyone. First of all, I will introduce myself. My name is Emma Yuliana and I will presentation about the result of my research. And the title is The Effect of Modern Knowledge about the nutrition for a child. The age under 5-year-old is a golden period. Stunting in children under 5 years of age is still not recognized because the difference between stunned children and normal children at the age is not very visible. The incidence of stunting arises due to a behavior, parenting patterns, knowledge of parents, especially mothers regarding nutrition needs for children, and result in stunt growth and affect development of children. The prevalence of stunting and malnutrition in the village of Gunung Semarang at 2019 is 16%, while mothers who have a low knowledge about nutrition is 75%. This will affect their level of knowledge. This study is to determine the relationship between family, income, and maternal knowledge about nutrition with the incidence of stunting method in children aged 0 to 5 years old. This type of research uses analytic observational method with cross-sectional approach with sampling technique using cluster sampling. The number of samples in the study were 20, as many as 14 children under 5 were stunned, for 4 children under 5 were not stunned, who met this restriction criteria. The data were obtained using a questionnaire and measuring height using microtests, and analyze data using a logistic regression test. Based on the logistic regression analysis, the effect of stunting, which was dominant in the mother's knowledge of nutrition, was obtained. P for value is 75%. This it can be concluded that the knowledge of mother about low nutrition is a risk factor for stunting in toddlers with a risk of 45%, while mothers who have a low knowledge about nutrition is 75%. This will affect their level of knowledge. The study aims to determine the relationship between family, income, and maternal knowledge. Okay, and this is the end of the video. Thank you for watching.
Assalamualaikum warahmatullahi wabarakatuh. I'm Dinda Haring Sudrajat and my partner Aditya Pratama. We are from the third group of grade 2B of Bachelor of Nursing STIKes YPIB Majalengka. We made this thesis to fulfill a computer science core assignment at STIKes YPIB Majalengka. We will present our thesis about
middle down social economic relationship towards mental school age children in achieving learning achievement. As example, students in public elementary school 3 Cipondo district, Tangerang City. Whether we are rich or poor, regardless of our social status, we definitely need education. Likewise, all parents want their children to get a proper education. However, not all children can get a proper education. The economic role of parents in general can be said to have an influence on student learning achievement. This research was conducted to determine the relationship between the socio-economic conditions of present and their effect on student learning achievement. This is research defensive and causal research that was used to obtain tested explanation of the effect of lower mid score economic condition on the mental of school-aged children in student learning environment.
Causal research is a research design that aims to determine the relationship and influence of one variable on another. The sampling technique in this research is using total sampling with a sample size of 20 people. Characteristic of respondents based on socioeconomic and student learning achievement with a socioeconomic percentage of 50% middle to upper class and 50% middle to lower class. Socioeconomic condition can affect student learning achievement, but they are not very significant or even very small. Students with learning achievement below the cut-off score are around 20% and 80% above the cut-off score of the total number of 20 students, which means about 10% of students with learning achievement below the cut-off score from the overall middle to lower socioeconomic condition are around 50%. That's all from us and thank you for your time. Assalamualaikum warahmatullahi wabarakatuh.
Before starting our presentation, let me introduce my head. I'm Jusnur Ihyania. Today, our thesis will be held with the community nursing care with the regulation of characteristics of school against children with the event of psychosocial bullying in social media, adolescent education in SMP Negeri 2 Suradadi.
Before we start, take the supervisor and explainer word PowerPoint. In today's presentation, we will discuss part 4 main point. Point 1, the first point of the initial on cover the background and profile statement. Point 2, the second main part action of the aims and before of the third. Point 3, the is point of the start, math house and threshold. Point 4, the last part of the lashing section comes in of closing and negation. It'll start with the first expression at the beginning.
Background. Bullying before is not only in physical of that is can share it, but the form of bullying that is known skin direct hand of serious infect. For example, when 3 are students, who are seniors, slanderers, mockers, and many other types of violence are indulgent in bullying before. Formulation of the problem. Cases of foreign bullying, which still occur in adolescent, but girl and boy, can have a negative impact that makes a frozen experience various health problems, both physical and mentally. The second part, which is the main part.
The second part, which is the main part. The purpose of the research is to find out the prevalence of social bullying on the with solution mental performance as the version and facial had your champions. Benefit of the search for information and insight about bullying to police and get lesson. The can be drawn from as in before relate to vision, the led to different and patient heart.
The core party of the theory consists of racial method and racial reason. Bullying is a form of violence before freedom is physical-social or physical coercion on a person or group of people who are weaker by a person or group of people. The perpetrator of a bully who is isolated, a bully can be a person. It can also be a group of people, and her or she is massive to have the power to do anything to her victim. Victim also perfect, selfish, afraid, helpless, and always feel threatened by bullying. This racial method, this study as description analysis method, but is taken from the sample. In this study, using a probability sampling technique with a professional random sampling approach. Result based on the result above. For the fact message, it is more like to get bullying before. This can be found by the result of the data. 40% with the result of bullying, something, and 45% for the result of frequent bullying were based on the our socio-economic status. The high level of bullying is at low economic status. namely IMUTS, as 50% of the total data student.
Conclusion, passion, blowing the two-fold not only is eye-frightening, but minta inform the elder drum is it not easy to net support from family, friend, and release be icing family and school. Pression to prevent bullying in school. Suggestion get it and Mr. The can be drawn from check is before fear on level of emotion distress in the cause progress social bullying. Maybe some version of our mini they has thank you to our several and ex-mina for summing. Thank you so much for your great nation. Waalaikumsalam warahmatullahi wabarakatuh.
Assalamualaikum warahmatullahi wabarakatuh. I will introduce our group. Okay, we are from 5 group and I'm from STIKes YPIB Majalengka. I will introduce ourselves. And my name is Anissa and my partner
Abstract will be with my partner.
Abstract violence against early children affected by lack of the economic factors related to the mental health issues of treated children in Cirebon in 2019. Economic is the biggest impact on violence that occurs in early childhood. One of the things experienced in psychology disorders such as trauma, depression, and mental disorders. Violence in early childhood occurs very much. So, early childhood should be safe from parental violence. The purpose of this study is to analyze violence in children due to economic factors in Cirebon in 2019. The type of research carried out is quantitative research. Using the approach and the sample in this study is early childhood in Cirebon in 2019 as many of 19 respondents with a serial sampling technique. The result of this research is that the economic status of parents is greater, about 57 comparison to the economic status of parents who are high, around 43, while promiscuity is 38, lower than that of ordinary people, around 62%. About 71% and children of experience poor healthy condition, around 29%. The elders can conclude that if the child has a good mental healthy condition and high economic status, it is likely that early childhood violence will not occur.
Next, I will give a presentation about chapter 1 until chapter 5. There are chapter 1 is preliminary. Next, there are chapter 2 is 1 understanding of physical violence against early childhood. 2 form of physical violence against children. 3 factors that influence violence in children. And next, there are chapter 3 is research methods, and chapter 4 research result. There are chapter 4 is many factor is gender, to age, 3 stage of mental illness, 4 the economic status of the parents, and the last association. And the next chapter is chapter 5. There are conclusion and suggestion. And then also I hope you all can get learn the result from me after. Wassalamualaikum warahmatullahi wabarakatuh.
Assalamualaikum warahmatullahi wabarakatuh. Greeting to all of us on this day, or many thesis will be held with the title Relationship of Clean and Healthy Lifestyle Behaviors Toward Water in Different to Reduction Diarrhea Event in Children in Majalengka Regency 2015 period. My name is Binur Rahim, and
I am Ika Andriani.
before we start, allow us to thank our supervisor and examiners who have been present.
This presentation we will discuss 4 main points. 1. Read the initial part, which involves the background of the problem and the formulation of the problem. 2. The 2 main part consists of research objectives and research benefits. 3. The 3 core part consisting of theory, type of research, and research result. 4. And finally, the closing part consisting of conclusion and suggestion.
Presentation, I will start from the beginning. Background. Health behavior can be manifested by an clean and healthy lifestyle. The implementation must be started from the smallest community unit, namely PHGS in the household, so that know they want and are able to practice clean and healthy living habits. Health problems that affect hygiene are in fact related to clean and healthy living habits, because the lack of implementation of clean and healthy living habits leads to high morbidity and mortality rates in toddlers due to one of the factors of spreading germs that cause diarrhea.
Formulation of the problem is that a relationship between clean and healthy lifestyle (PHBS) and mothers in an effort to reduce the incidence of diarrhea among children under 5 in Majalengka Regency.
The second part, which is the main part. The purpose of this study was to determine the relationship between clean and healthy living behavior (PHBS) to mothers in an effort to reduce the incidence of diarrhea among children under 5 in Majalengka Regency.
Of this research is to become a source of information for mothers in an effort to reduce the incidence of diarrhea among children under 5 in Majalengka Regency.
Continuing the presentation of the core part, consisting of theory, types of research, and research and result. Diarrhea is still a public health problem, especially for children. One of the causes of diarrhea is environmental and behavioral factors. Diarrhea can be prevented if people apply clean and healthy behavior (PHBS). The implementation of clean and healthy behavior (PHBS) is in fact depends on the behavior of the mother clean and healthy life, because babies still cannot do everything with themselves.
This type of research is a quantitative study with a cross-sectional approach, and the sample of this study was taken from respondents using accidental sampling technique. The result showed that 75% experienced under 5 morbidity due to abnormal diarrhea, and 25% experienced under 5 morbidity due to normal diarrhea. Come the closing section. Conclusion. Based on the result of the study, it showed that the incidence of diarrhea is more prevalent in mothers with poor hygiene and healthy behavior, which cause 75% of children under 5 to experience fine due to abnormal diarrhea, and 25% of children under 5 experiencing fine due to normal diarrhea.
For researchers and readers, the people get something in responding and listen from change in behavior.
Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Assalamualaikum warahmatullahi wabarakatuh.
Before starting our presentation, let me introduce myself. I am Sanya Musliman Devi, and here I am partner.
Dan Muhammad Ramdan.
We are from Group 7. This is presentation we are going to discuss about this part of examining cognitive of smartphone on everyday health in adolescent children in Majalengka district Perda to 2018. Of smartphone in the current era globalization in terms of how obsessed about the impact of smartphone. Reduction of health expression from aging up, men and the women of cross against. Both you and the on the user of smartphone, among others in particular, is I need that must be fulfilled every day. The law of things uses the smartphone and the causes in using the smartphone every day. Of the impact caused by using the smartphone is eye disturbation by the use of eye smartphone will experiencing several symptoms.
15 respondents in the Majalengka district with a cross-section survey technique data analysis, which includes giving questionnaires and conducting visual examination using a Neren card with the crystal test. This research is a review of covering the impacts of smartphone a health vision trigger for a health problem. The research showed that the negative impact of smartphone usage when a health around 27 with 17 years of age. Older people use smartphone more often at all times for long hours and without paying attention to the impact arising from smartphone usage. The authors conclude that if the respondent know the negative impact of smartphone usage when a heard and know the time period for using a smartphone, that is good for health. For using a smartphone, that is good for health, and now the right possession in smartphone usage. It is likely that there will be no negative impact on smartphone usage, especially on a health.
Thank you so much.
For you get attention.
Wassalamualaikum
warahmatullahi wabarakatuh.
Assalamualaikum warahmatullahi wabarakatuh. We are from Group 8. Here, me and my friend would like to Yes, of the right
Majalengka will respond essential something technical, data analysis, analysis, frequency distribution, and variance analysis using the SQL test. This research is a review of journal conferring the factor, the cause and some symptoms, treatment, prevention, and impact. Result of the study suggests anxiety level from age 20 to 40 years, 8%. Average anxiety level from age 20 to 40 years, 24%. Mild anxiety level from age 20 to 40 years, 52%. Asymptomatic for age 20 to 40 years, 60%. Young people have a higher level of anxiety about knowledge about COVID-19. The other can control the anxiety in pregnant women due to coronavirus. Request knowledge of COVID-19. Motivational motivation from lost people. Thank you for watching.
Assalamualaikum warahmatullahi wabarakatuh. I am Kitana Halimah and this is my partner.
Galip Pradika Baristiana.
We came from Group 9, a computer science class 2B nursing STIKes YPIB Majalengka. We are going to explain our mini thesis entitled The Effect of Cigarette Smoke on the Relapse Intensity of Chronic Asthma Patients in Majalengka, 2020. Everyone is familiar with smoking, even how many women are addicted to cigarettes. Smoking has become commonplace in society, as well as cigarette smoke so that people who don't smoke can inhale it anywhere. Is it clear that smoking is very dangerous to health, one of which a disorder trait such as chronic asthma. Chronic asthma sufferers are very sensitive to the environment, especially the environment with cigarette smoke. When the intensity of the recurrence of tiredness in people with asthma is very high. This study was conducted to determine whether cigarette smoke has an effect on the intensity of recurrence of shortness of breath in chronic asthma sufferers. This is a type of research is currently studying analytical observational. The sample count in this study amount to 20 people.
The sample techniques used in this study is to the conversion sample method, which is to the text respondent who happen to be present or available. The step is analysis used in this session is a frequency description analysis. The data in this study for abstract from Western science that have been filled in by respondent will then be analyzed definition from the present that has been done. It can be counted that cigarette smoke after the infancy of frequency of restlessness, where in infancy of frequency for shortness in breath will itself when from chronic asthma. Supported are in environment with cigarette smoke of the 75% of respondents who are in the environment status will cigarette smoke. 60% of them have a high intensity of weakness. This prevents that in the environment play important role in controlling the intensity of frequency or illness of brain in chronic asthma sufferers.
That's all our presentation. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. Introduce, my name is Gugun and with friend.
My name is Anissa Fadila.
I will present the fulfillment of nutritional needs in elderly patients with hypertension or hospitalized at Children's Hospital in 2018. Hypertension is a condition when the blood pressure against the artery walls is too high. Usually, hypertension is defined as blood pressure above.
The following is a classification of level in other hypertension. Pre-hypertension, a systolic blood pressure of 113 to 139 mmHg or a systolic blood pressure of 18 to 89 mmHg is a classification as pre-hypertension. Hypertension level 1 systolic blood pressure 114 to 159 mmHg or diastolic blood pressure 90 to 99 mmHg need treatment. Systolic blood pressure more 160 mmHg pressure more 100 mmHg. At this stage, suppress usually need more than one drug. Hypertensive crisis. If your blood pressure suddenly exceeds 180 or 120 mmHg, you have a hypertensive crisis. At this stage, you should immediately contact a doctor.
Say and system. High blood pressure often causes no system. Over time, if left untreated, it can lead to heart problems such as heart disease and stroke.
Trigger factor: gender, age, family history, environment.
The frequency distribution of NCT level in patients with hypertension show the highest distribution in mild NCT, namely 63 above 75%, and the lowest distribution is moderate, as many as 21 above 21%. Then we did the research, and based on the result of the research conducted at the hospital Children's in 2018 for 20 elderly respondents, both hypertension to knowledge, it can be conducted from 20 respondents that it was concluded that before the research was carried out,
the knowledge was less than 40% and the good knowledge was around 60%. There is a significant influence between again the level of knowledge, namely from the age of 60 or 90 years the knowledge is lacking or lack of information. From this result, assistance is needed, especially the closest family. That's it all, and thank you for the presentation from us.
Wassalamualaikum warahmatullahi wabarakatuh.
Assalamualaikum warahmatullahi wabarakatuh. To the honorable examiner of a final examination, first of all, let me introduce ourselves. That my name is Gita Nur Aziza, and this is my partner,
Hendrayani.
Today, in this lovely morning, we would like to thank that the time has given to us to present our final assignment with the title, The Correlation Between Stress Coping Mechanism and Sleep Pattern to Improve Comfort and Recovery for Hospitalization in Preschool Age in RSUD Majalengka. First, let me start by chapter 1. The background of research. Every parent wants to do best for their child when they are sick. One way is by doing hospitalization. But emotional condition and stress on illness in children aged 3 until 6 vary widely, such as depend on adult and have unstable nature and emotional unstable. Next, the formulation of the problem is the correlation between stress coping mechanism and sleep pattern to improve comfort and recovery for hospitalization in preschool age in RSUD Majalengka. Next is about purpose of research is to analyzing between the stress coping mechanism and sleep pattern in preschool age during hospitalization. And the last is about the benefit of research. The benefit is to add information, insight, and evaluation material used by nurse and other medical personnel to solve the problem in hospitalization in preschool age. Next is about the theory of this research. First, children are vulnerable to disease crisis and hospitalization due to 1. Stress due to normal healthy change and different environmental routine. And the second one is children have limitation in carry out coping stress mechanism to resolve the stress. Next, about chapter 3.
Method of research. The thesis research refers to the observation of correlation between stress coping ability and the sleep pattern in children of preschool age. The observation data consists of impacted room, including the Rose on Child and Jasmine room. This research was held in February 28, 2021. Next, the result of research. Based on the result of observation, we have interpreted the data into a correlation between stress coping and sleep pattern of preschool children during hospitalization. Evidence by the data obtained the 43% or 30 respondents of the 30 pattern expressing stress level was during a period of hospitalization, and 30% or 9 respondents of the 30 patient expression a level of mild stress during a period of hospitalization can depend to the need for sleep report by data obtained as much as 30% or 10 respondents out of 30 parents expressing moderate sleep pattern, 46% or 14 respondents of the 30 parents experience good sleep pattern. Next, consolation. Stress coping mechanism is when children need to support by specific activity, support the improvement of the stress level and sleep pattern toward increased comfort and healing.
Okay. Finally, we have presented all of presentation. Thank you for attention. Wassalamualaikum
warahmatullahi wabarakatuh.
Assalamualaikum warahmatullahi wabarakatuh. My name is Lulu Nadia with my friend Muhammad Fikri Nur Hidayat. We here will presentation a mini thesis entitled Description of Parenting Patterns in School Age Adults Can in an Effort to Prevent Methamphetamine Drug Abuse in Majalengka District in 2016. Case example Senior High School to Majalengka. The increases in the use of methamphetamine type drugs raises concern in adults can about the side effect of drug abuse on health. The abuse of methamphetamine type drugs among adults can, especially school children, as a transitional period. Is often uncontrolled, so that it is easy to fall into behaviors that have a negative impact on themselves and others. The role of drug abuse and the involvement of parents in the implementation of parenting is one of the factors that influence drug abuse in adults. The purpose of this study is to explain the relationship between parenting style and the incidence of drugs abuse in adults at Senior High School to Majalengka. This type of research is a quantitative study with a survey research design, and the sample in this study is 20 respondents of teenagers in Senior High School to Majalengka with a cross-section survey technique.
Data analysis with student giving evaluation and conducting on urine test. Test and it's a review of students suffering in case of drug abuse on head, a risk factor for mental health disorder. The results had a negative influence of drug abuse on mental health with 80%. The student aged 15-16 years of age were less knowledgeable and after head was scared off. And all of students were with insurance and subsidies which go around 55% and average on at about 40%. The author concludes where it has responded notes had negative influence of drug abuse on health, and all evidence of drug abuse are not good for mental health. Thank you for watching. Wassalamualaikum warahmatullahi wabarakatuh.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nadia Luciana Anggrayani with my friend
Rosi Agus Al-Zuhri.
Here we will present a mini thesis entitled
Relationship of stress level of school age student smoking habits in Senior High School to Majalengka period 2018.
Smoking behavior is still widely available among adolescents, especially school students. Even people start smoking when they are teenagers. A number of studies confirm that most smokers start smoking between the ages of 11 and 13 years and 95% to 95% before the age of 18. Adolescent behavior is influenced by family and environmental factors. This study aims to determine the relationship between stress level of adolescent and smoking behavior of adolescent students with a cross-sectional approach, and the research sample is taken from respondents using accidental sampling technique.
The data analysis include univariate analysis with frequency distribution and bivariate analysis with chi-square test. This study is a review of journal which show that there is a relationship between the level of stress in the family environment of school-age students on smoking habits at school age. The author can conclude that there is significant relationship between the level of stress on the smoking behavior of adolescent students of Senior High School to Majalengka. For further research, more respondents, and better measuring tools are needed to enrich the accuracy of the research result. Keyword: stress smoking at school age.
Thank you for watching. Wassalamualaikum warahmatullahi wabarakatuh.
Assalamualaikum warahmatullahi wabarakatuh. Before starting our presentation, let me introduce myself. I'm Anissa Febriana, and here is my partner,
Dunia Pujiani Astari.
We are from group 14. In this presentation, we are going to discuss about influence of family relationship in care of petition with history of sexual violence behaved in Indonesia 2016. Influence of family relationship in care of patients with history of sexual violence behaved in Indonesia 2016. Abstract. Sexual violence that occurs to everyone. 1. The which is teenagers which can have impact on their psychology. Sexual violence can also have a deep impact on victims and can have an impact traumatic. Stress disorder that can become victims which can be called post-traumatic stress disorder or PTSD. This is to the aim to look at post-traumatic stress disorder in adolescents who have a history of sexual violence in Indonesia. The sampling technique in this study uses a cross-sectional method. This study focused on petition with violence in Indonesia by taking a sample of this study focused on petition with violence in Indonesia by taking a sample of 20 respondents with the provision of accidental sampling technique.
The instrument measures data in the form of an online questionnaire to see post-traumatic stress disorder. The results showed that more than taking respondents are at risk of experiencing PTSD. Results showed that more than taking respondents are at risk of experiencing PTSD due to sexual violence. They have experienced it. The results showed that about insufficient knowledge about 25%, and after doing research, the knowledge of victims with sufficient knowledge become 25%, and victims of knowledge become 75%. For future research, it is hoped that early prevention can be done with therapy activities for victims of violence who are at risk of PTSD. Keyword: sexual violence, adolescents, post-trauma stress disorder. Thank you so much for great attention.
Wassalamualaikum warahmatullahi wabarakatuh.
Assalamualaikum warahmatullahi wabarakatuh. Hello, introduce myself. My name is Asmini Ramelu, and my name is Dami Ransa. We were from the group of 5 people. Here we will present a thesis and assignment. Negative effect of skincare on early trimester pregnant woman dari hormonal change at Posyandu Mawatri, Majalengka period of 2019-2020 from the STIKes YPIB Majalengka campus. Computer courses. Let's get started.
Dari pregnant, there will be various steps in but physiology and psychology. These steps are regularly due to the influence of hormones. The effect of hormonal changes that take place during pregnancy also play a role in emotional changes, particularly anxiety, indisposition, concentration, and preference diminishes. This causes the mother to feel uncomfortable during pregnancy and major stress.
Next, a quantitative research method adopted by Sukirno 2011 questionnaire A, namely questionnaire research method based on the philosophy of positivism, are used to examine specific population or sample. Data collection these questions include quantitative or statistical data analysis with the times of testing hypothesis. The instrument used for the knowledge data is a question, and for the data on knowledge of pregnant women about psychological change in pregnancy using an observation sheet.
This type of thesis is a descriptive study which aims to determine the description of the level of knowledge of pregnant women about the physiological change in pregnancy. The population in the study were all pregnant women who performed antenatal care at BPM Fauzia, Hatta Palembang. The sampling technique in this study was that all pregnant women who come to check their pregnancy at the independent practice guru BPM Fauzia Hatta were obtained 32 people.
Next, the unique result found that the frequency distribution of education was 68.8% of pregnant women with high school education. The frequency distribution of parity at 87.5% of pregnant women had more than 3 children, or also called grand multipara. The frequency distribution of knowledge of pregnant women in the first trimester 59.3% of mother had knowledge law. The distribution of the frequency of knowledge of pregnant women in the second trimester was 53.1%, quite high knowledge. The distribution of the frequency of the knowledge of pregnant women in the third trimester was 53.1%, with low knowledge. It is hoped that after taking the action, health workers can provide counseling or liberate to pregnant women so that they can have insight or knowledge of pregnant women during pregnancy. That is all, and thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Hello, my name is Desi Suryani and my partner Nurul Fauzia. We are from the group 16. We will present a thesis entitled faktor-faktor yang mempengaruhi perubahan bentuk badan ibu hamil pada trimester kedua. Every woman must experience changes in her body. These changes not only break pressure but can also cause anxiety. As women realize that two are attractive, are usually treated better than women who are less attractive. It is not surprising that more and more women are taking care of their body for research to look attractive, fashionable, to look ideal even to they have given birth and the anxiety, their physical appearance. This type of research is a quantitative study with a quasi-experimental research. This using quasi-experimental. With this research is used to find a cause and effect relationship in the presence of certain intervention of treatment. The sampling technique in this study used a total sampling or 20 people.
The research showed that anxiety in body shape in trimester 1 pregnant woman from the age of 1 year. About 3% of pregnant tigers in the mother body shape have sufficient tiger attitudes from the age of 1 year. About 6% pregnant tigers in the mother body shape. This tiger in attitude were in the level of mother from the age of 2 to 3 years. About 6% of anxiety about tigers in the mother body shape from the age of 2 to 1 year. About 6% of them are less aware of tigers' body shape. There are several effects of tigers that occur during pregnancy. Therefore, many mothers are worried about tigers in body shape during pregnancy at Masjid Puskesmas Majalengka. Pregnancy.
Hello guys, Assalamualaikum warahmatullahi wabarakatuh. Introduce myself, Raftani, and this is my friend
Dian Fernanda.
We are from book 17. Here my friend and I would like to explain about the mini thesis. We talk and tell that relationship between birthday babies with disability in the event of abortion 18 to 2019. Have a good watching.
A lifestyle that is wrong like that should be avoided so that the body is not susceptible to discharge and is safe for the baby and the mother too. The most important thing is to realize the importance of maintaining a healthy body. After realizing that maintain a healthy body for the future, this is to determine the risk factor that affect congenital neurological disability in infants born at fetal birth with disabilities premature. The incidence of abortion, this type of rash is a quantitative study with a rash. The seeing quasi-experimental. The instrument asked for family support that was a questionnaire and for positive response that from families in pregnant women using a birth observer. The sampling taken in the study achieved total sampling with a sample stage of 13 people.
Next, the results showed that before carrying on abortion from the age of 21 to 20 years, about 30% of mothers with abortion had adequate work status from 19 to 20 years of age, with abortion had allowed occupational from the age of 21 to 20 years. About 36.0% of abortion mothers are unable to maintain the baby in their womb and after performing the abortion from the age of 19 to 20 years, about 17% of them are able to perform the abortion procedure. There are several effects of abortion due to have there are several effects of abortion due to heavy bleeding, severe infection, duodenous, ectopic pregnancy, and pulmonary area in Majalengka will always socialize about healthy to women and cooperative with healthy works. Thank you for watching your video. Let's end more of apology. Wassalamualaikum warahmatullahi wabarakatuh. Bye.
Assalamualaikum warahmatullahi wabarakatuh. My name is Evita Kusmadewi and this is my friend Elsa Mahatimala. We are from the group of 18 with title of the thesis Factors Affecting the Level of Mother NCT During Session Labor Process. As example, labor process at the Rikasia Majalengka Hospital 2020, STIKes YPIB Majalengka and Computer Science course. Okay, first of all, every human being on earth was created by God with the perfect form as well as feelings. God gives feelings to patients in a very detailed research, including NCT. This type of research is qualitative research with a descriptive analysis design using cross-sectional. The instrument used for NCT level data was a questionnaire from data vector inclusive NCT level used and observation sheet. The sampling technique used in this study used total sampling with a sample size of 20 people. The results show that the factors that affect the level of NCT of women with cesarean delivery are age, education, and occupation. From the mother's age factor of 21 until 22 years, about 20% of mother experience severe NCT, and the mother's age of 23 until 25 years, about 18% experience mild NCT. Educational factor, about 18% of mother experience severe NCT and 20% experience no NCT, and from work factors.
Mothers who experience SCCND level lows around 18% and 20% of mothers will, mild 20% of mothers will, and pure NCT before cesarean section. There are several factors that affect the level of anxiety of mothers who give birth by cesarean section, such as age, education, and work. It is hoped that support from the family, from the level of knowledge, and also education to minimize the level of anxiety of the mothers giving. Both FS Dipasa Kadipaten Distrik Majalengka.
Okay, enough of our presentation. Please forgive us for the shortcoming. Wassalamualaikum warahmatullahi wabarakatuh.
Assalamualaikum warahmatullahi wabarakatuh. Greetings to all of us. Today our mini thesis trial will be held with the title Factor Relate to Stress Level Event in the Class and Faculty of Education Nursing Yayasan Pendidikan Imam Bonjol 2000 is Dia Karamawati and Hervitayu Yulianti. Before we start, allow us to thank all supervisors who have been present. In this presentation, we will discuss 4 main points. The first is the initial section, which covers the background of the problem and the formulation of the problem. The second is the main part, which consists of research object and research benefits. The three in the core part, which consists of theory, research method, and research result. And finally, the closing session, which consists of consultation and solution. The first presentation, I will start the beginning. Background. Human life the world requires knowledge and insight. So, the argument that higher education is made higher education can be obtained at the university level. In the first year student, there are many change or life transition due to the shift from the high school to new student at university. First year students have different level of stress in dealing with their change. Change that occur can be in the form learning style, achievement, target, and other problems. Problem formulation. 1. What are the stress factors that affect new students? 2. How do you deal with stress experienced by students? Enter into the second part, which is the main part. Purpose this study is to determine the factor associated with the incidence of stress level in first year students of the Faculty of Nursing STIKes YPIB Majalengka. Benefit of this research is to become a source of information for students in the learning process while in college, especially at the Faculty of Nursing STIKes Majalengka.
Here, I am Hevita Yulianti will continue the presentation of the core part consisting of theory, research method, and research result. Stress is a situation where the burden that a person feels is not commensurate with the ability to cope with the burden. Salmon and Markham 2008. Stress symptoms according to Hazana include physical symptoms, emotional symptoms, intellectual symptoms, and interpersonal symptoms. Then, the stress level is the result of an assessment of the severity of stress experienced by a person. This stress level can be mostly demanded, classic, or rough, with using the present exist stress scala TSS by Levibon and Levibon 195, which can be divided into normal, mild, moderate, and severe stress. The research method that we take using quantitative research with the type table research using a quasi-experimental research design. The research set-wise conducted at STIKes YPIB Majalengka in February. Our study population was the first-year student of the nursing undergrad study program, using a research instrument in the form of questionnaire question or 10 questions related to stress level. Result: the population in the study among 20 students consisting of 13 female students and 7 male students ranging from 18 to 20 years. Based on the result of the research that has been done, the result of the student analysis show that the seven stress factors describe the academic technique and learning activity of students at the age of 19 around 35%. While the moderate stress factor is for experience-based students and the social experimental stress level at the age of 19 around 80%. Next is the closing part. Conclusion is that academic stress factor is mostly dominant by 5. Around 55 at the age of 90 years, it has helped the student will result in independent learning motivation students to reduce stress. Suggestion for research and students gain insight the response and listen learner form change in the stress level in study. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Assalamualaikum warahmatullahi wabarakatuh. For starting our presentation, let me introduce myself. I am Maratul Rahma and here my partner
Ika Cahya.
We are from group 20.
In this presentation, we are going to discuss about negative impact of sweet foods on golden week teeth. Case example, elementary school students in Majalengka District 2019.
Most of the food provided is sweet food containing sugar and other snacks. Students can feel like choose the food provided in the canteen.
Dental caries is a little health problem that most often occurs in early childhood. Dental caries cause the teeth to become porous with broken holes, resulting in less than optimal growth.
An observation is known that students prefer to choose food or snacks that contain sugar, such as candy, chocolate, and sweet cakes.
This type of research in an analytic survey that aims to analyze the effects of health behavior on the incidence of dental caries in SD Negeri Majalengka Wetan 2 studi.
Instrument used for knowledge data was a questionnaire and for the cryogenic food observation of children with dental caries. An observation sheet was used.
Technically, in the study used total sampling with a sample size of 25 people.
The results showed that there were data on SD Negeri Majalengka Wetan 8 student aged 7 to 9 years that about 72% of SD Negeri Wetan 8 Majalengka children are dominated by women aged 7 and 9 years at a risk of expressing dental caries, and about 28% who are dominated by men are not at risk of expressing dental caries, and some of the modern knowledge is relating about dental and oral hygiene. Children habits of brushing their teeth are not good. Children are accustomed to consuming sweet foods, and most children suffer from dental caries.
It is hoped that the Majalengka region will always socialize about health to children and cooperative with health for staff.
Thank you so much for your great attention.
Wassalamualaikum warahmatullahi wabarakatuh.
Assalamualaikum warahmatullahi wabarakatuh.
Hello, I am Tanti Febrianti and this is my partner
Inta Kulnisa.
We are from Group 21 Level 2B S1 Nursing STIKes YPIB Majalengka. This is entitled Factor Affecting the High Emotional Children, Tonjong Village in 2019 until 2020 with Communication Sciences courses. The family is the place where the children grow and develop. The family is also the smallest unit in society that can consist of husband and wife, husband and son, father with children, or only mother with children only. Emotional is a person power that allows man to think as a whole, able to recognize his own emotional, the emotion of other, and know how to express them like of affection from parent that makes a child friendly, frustration, brutal, and angry. A broken home, children are living in family full of conflict must get assessment, solution, protection, full treatment of nutritional needs because surely his starts then psychiatry can be scanned especially if the minor can express mental pressure if feels continuously can cause high emotional level until depression.
This type of research is quantitative research with research design using pseudo experimental quasi-experimental. The sampling technique in the study uses a total sample with a sample cost of 20 people.
It is the expect that the area in Tonjong Village will always socialize about healthy and broken home children and cooperative will hardly workers. Thank you very much for your great attention. Wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh.
Assalamualaikum warahmatullahi wabarakatuh. Hello, introduce you from the group of 22. I am Pani and my name is Intan Trikusuma Astuti. Here I will explain our thesis and child factor related to adults can knowledge about sexual transmitted infection in junior high school 1 Majalengka to fulfill the assessment of computer science course at STIKes YPIB Majalengka. Until now, sexually transmitted infections are still a hot social and economic problem in many countries. In several countries, it was stated that the implementation of an intensive extension program would reduce the incidence of sexual transmitted infection or at least remain relatively constant. Most people with sexual transmitted infection are adolescents aged 15 or 19 years. But there are also babies who are infected because they are infected from their mother. The high incidence of sexually transmitted infection, especially in the adolescent age group, is one of the causes of this relatively low level of knowledge among adolescents. This in turn will affect adolescent attitudes towards sexual transmitted infection.
This study aims to determine the level knowledge of students senior high school 1 Majalengka against sexual transmitted infection. The research that was conducted was descriptive and was conducted using a survey method with a cross-sectional approach. The sampling technique used in this study was total sampling with a sample size of 20 people. The research showed that before the research was carried out from the age of 14 to 16 years, about the 10% of students has a good level of knowledge. From the age of 14 to 18 years alone, 28% of students has sufficient knowledge. From the age of 15 to 18 years alone, 16% of students had knowledge. While after the research was carried out, around 20% of students has good knowledge. And at the age of 15 to 18 years, about 17% of students had sufficient knowledge. From the result of this study, it is hoped that school and outside school can provide information about reproductive health and sex education to test students. Maybe some of our mini thesis action presentation. Thank you to our supervisor examiners who were present.
Here is the first step our students on study intelligence official of the four vasto model canal levels over the hospital is based on mother is characteristic. In infant care is step of baby care and is until the mother so the mother and can perform basic care for the baby. The combined care also has a mom and the combined and care has been used in almost all hospitals in Indonesia. I presentations so many and presentations is my eye and what the is oral and sensory and I'm so sorry so much and feels that my friends feels continue.
And the total subject is people and if the subject match these criteria, the match is unsaid. Big filling out a questionnaire with of the age group from age 22 to 24 and get chapter from 19 to 21. And with the family category 90 day present and less than the page. A contact from us upload as much as possible if the tree is and it's delivery.
My name is Ida Diana Waryaputri and my name is Siti Ainuna Jibolani as from the group of 24. The title of our thesis is about factor relative to quality of life for stroke patient in Tukana Majalengka in 2020. Computer Science course. STIKes YPIB Majalengka. Here we will explain a little about the quality of life in post-stroke patients. The importance of maintaining health is very necessary, especially humans their bodies. As they get older, maintaining health will have a good impact in the as they get older. Maintaining health will have a good impact in the future. The number of various kinds of disease can further increase rates and caution so as not to deteriorate disease. This study used an analytic observation study design with cross-section approach. The instrument used for the knowledge data was a questionnaire, and for the data on the ability of postal number of samples in this study, 22 patients. The results selected before the study was carried out on postal patients whose quality of life was not good and lacked sufficient support from their families. Around 80% aged 2080 to 41 years experienced poor quality of life and lack of support from family. After conducting the study, there were more than 70% in age 20 to 41 years, including early adult and late adult postal patients who had good quality of life and support from family. Variables related to postal patients' self-efficacy were gender, age, and family support. Care priorities typically include patients who have problems in recovery. It is hoped that the Majalengka area will always socialize about maintaining a healthy lifestyle and collaboration with health workers.
Assalamualaikum warahmatullahi wabarakatuh. Introducing, my name is Sylvia Damayanti
And my name is Cynthia Sukma.
We are from the 25 group. Here we will present our thesis about the relationship of the first menstruation with the level of anxiety.
For example, this case of the state high school di Bantarujan. This thesis is to fulfill the assessment of the computer science course STIKes YPIB Majalengka.
Menor is the first discharge of blood in the woman as a sign of the maturity of the sexual organ as a woman. There are the classification of menors, namely early menor precox, menor normal, menor slow tarda. Signs and symptoms include headaches, cramp in the lower abdomen. The bleeding time is 5 to 7 days or less. Stiffness in the legs and backs for several hours. Irregular bleeding.
Legal factor for menors: genetic, status and diet, media exposure, environment, physical activity. The level of anxiety is divided into 4 namely light anxiety, moderate anxiety, heavy anxiety, and severe anxiety or panic.
As for the effect of anxiety for minors, learn excitement, deficit, social isolation, have depression. Then we conducted a study and based of the result of research conducted in State Junior High School di Bantarujan in 2000. Then we conducted a study and based on the result of research conducted in State Junior High School 3 Bantarujan in 2020 and 20 respondents regarding the level of anxiety of female adolescents in facing menopause or menstruation. For the first time, it can be concluded from 20 respondents as many as 30 respondents. 65% experienced anxiety.
Male and as many as 7 respondents. 35% experienced moderate anxiety, and there was a significant influence between age and anxiety level, namely from the age of 12 to 14 years. There was still a lack of knowledge or lack of information from the family. From these results, it is necessary to provide family assistance, especially a mother, which shows a good influence on young woman when she experiences menopause.
Thank you for watching. Wassalamualaikum warahmatullahi wabarakatuh.
Greeting to all youth. My name is Heling Julianti and Shukrania Nurhanka. Today our mini thesis deal will be held with the title Psychology stroke Cognitive Behavior Therapy for Patient who experience mental disorder due to violence at RSUD Arjawinangun, Cirebon. Before we start, thank our supervisor and examiner lecturers who have been present. In this presentation, we will discuss 4 main points. The first point of the initial section covering the background and problem formulation. The second main part consists of the objective and benefits of the research. The third part consists of theory, research method, and research result. The last part of the conclusion and suggestion. I will start with the first presentation at the beginning. Violence still occurs a lot in the community besides that it can danger someone. Violence often occurs at all ages. The impact is not only on physical but psychology impact as well. This results in a sense of trauma and even depression. Formulation of the problem. How to use cognitive behavior therapy method in patients with mental disorder due to violence. The second part, which is the main part. The purpose this research was to determine behavior change in patients with mental disorder due to violence through cognitive behavior therapy. Benefit of the research: to information and to add insight into mental disorder due to violence and get lessons that can be taken from change in behavior related to violence that result in mental disorder. The fourth part consists of the theory of research, method, and research result. Mental disorder is a condition that is closely related to individual problem and can experience unfavorable condition of will, aspect of stigma and labeling that are inherent in them. Cognitive behavior therapy. This therapy will help client by removing bad thoughts and belief in client to be replaced with better mindset construct. Post-trauma stress disorder is a mental disorder that can occur after experiencing or witnessing a life-threatening event such as a battle, natural disaster, accident, or individual acts of violence such as rape or physical. This research method with cognitive behavior therapy techniques by modifying behavior and changing maladaptive belief using a psychotherapy approach with variants of emotional and behavior change techniques that usually use intervention to get agreement on target behavior. The result of the research based on a book, the substantive conclusion that the psychological approach to cognitive behavior therapy in patients who experience mental disorder due to violence is related to emotional shame and level of depression experienced with result of the research 19 or 18 of the number of respondents associated with mental disorder. The last part, the conclusion and suggestion. Mental disorder due to violence not only affect physically but mentally. To heal the trauma it is not easy. To need support from family, friends, and relatives by using psychology approach from cognitive behavior therapy. Suggestion: get insight and wisdom that can be taken from change in behavior and level of emotional disturbance adolescent through cognitive behavior therapy. Maybe some of our mini thesis exam presentation. Thank you to our supervisor and examiner who were present.
Assalamualaikum warahmatullahi wabarakatuh. I am Teddy Mudi and this is my colleague. We are from group 27, class 2B S1 Nursing STIKes YPIB Majalengka. We will present this is capital monitoring the result of occupational therapy in PUB. Mother student the education level of grade in impact is it 0.61. This need example data Jati 219 220 with a communication skills first. Every mother wants her child to breastfeed directly from the mother's milk, but sometimes the mother does not produce enough milk to let she still cannot provide adequate nutritional and food for everybody. This level of research is a qualitative study with research design using quasi experimental. The instrument used for the knowledge data was a questionnaire, and for the data on the ability of breastfeeding mother to use an observation kit. The sampling in the is using total sampling with a sample size of 20 people.
The research showed that before doing acupressure therapy in breastfeeding mother, from the age of 30 to 35 years, about 20% of breastfeeding mother had sufficient amount of milk production. From the age of 29 years, about 80% of breastfeeding mother had the amount of milk production in the low category. After doing acupressure therapy from the age of 20 to 35 years, about 80% of breastfeeding mother already have sufficient amount of milk production, and from the age of 20 years, about 20% of breastfeeding mother, the amount of breast milk production is still in the low category. This is an effect of acupressure therapy in breastfeeding mother to increase the amount of milk production in mother in an effort to meet the education of breast milk in infant ages 0 to 6 months. This is hope that the oral institution will always sociality about the importance of breastfeeding for the development of baby and fertility with health workers.
Thank you for listening to the video presentation from our group 27 more or less story. Billahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh.
That's the mini thesis video from various class 2B groups. More or less, please forgive me. That's all, and thank you.